Assalamualaikum and hi everyone. So today we will be discussing about cerebral palsy. So cerebral palsy is a leading cause of crippling handicap in children. It refers to a group of disorders of movement and posture due to a permanent, non-progressive insult in a developing brain. So although the brain lesion in CP is static and non-progressive, the clinical picture often progresses or changes over time. The definite cause is unknown to many children. The known cause of CP can generally be divided into three timing of events, which are antenatal, intrapartum, and also postnatal. So the example of causes in prenatal are cerebral dysgenesis, congenital infection such as torches, cerebral vascular events such as thrombotic or hemorrhagic disorder, and also placenta pathology such as placenta abruption and also placenta previa. In intrapartum, asphyxia and chorioamnitis are the causes, while in postnatal, intracranial infection, traumatic brain injury, hydrocephalus, and kernicterus can be the cause of CP. This CP can be caused by more than one pathological process. So clinically, CP can be classified according to motor disabilities, anatomical and neuroimaging findings, or etiology. So I will be discussing on classification based on motor function. So the first one is spastic cerebral palsy, which contributes the majority of all CP. It involves damage to the cerebral motor cortex, which is the pyramidal tracts. Damage to the basal ganglia results in dyskinetic cerebral palsy, and ataxic cerebral palsy is due to damage to the cerebellum. So let's take a look at spastic CP first. The form of CP in cerebral cortex depends on how much the area is affected. For example, here, the affected region is at the left upper limb and lower limb motor cortex. Therefore, the child will have stiff limb on the contralateral side, which is at the right side of the body. This child will have impairment of arm and leg on the same side, which is called hemiplegia. Similarly to diplegic cerebral palsy, which it affects more on the legs as compared to arm. Thus, both lower limbs may be adducted, forming scissoring of legs. In quadriplegic is when both bilateral upper and lower limb motor cortex is involved. The child will also present with all limb stiffness and both hands most of the time. Next is extrapyramidal cerebral palsy, which involves damage to basal ganglia and also cerebellum. In ataxia cerebral palsy, all of the bodies are affected. The cerebellum is an important part of the brain that functions for balance, posture, and also coordination. As a result of cerebellum dysfunction, the person will have a wide gait, uncoordinated, and also involuntary movement. Lastly is dyskinetic cerebral palsy, which involves damage to the basal ganglia, creating dystonia, which is the commonest presentation. This is characterized by involuntary muscle contraction, causing repetitive movement of joints. Associated problems in cerebral palsy is learning difficulties, visual impairments, hearing loss, speech disorder, behavioral disorders, orthopedic deformities, also social problems. Cerebral palsy is a clinical diagnosis, so there is no specific diagnostic test. However, brain MRI can be done to look for location and extent of the lesion. So that's all from me. Thank you.